I can honestly say that this panel is going to be unlike many other panels.
We are lit.
Welcome back to Zero World 2016. I'm David Temple with, by nickname only, Scrammy, OB, Smorgasbord, Schultzy, and Deputy Doc. You guys can figure out however you want it to feel. Today, as our Zero World comes to a close, let's talk implants. Talk amongst yourselves.
They're great.
I love them.
Yeah.
They're awesome.
I've been a huge fan of implants for a while.
Yeah. Somebody should write a book.
We're talking about dental, right?
Yeah, someone should write a book on that.
Yeah.
Okay.
Somebody should make some software or something you could actually, like, do the implant, make the restoration all together, plan it all out. That'd be kind of a cool idea.
And if they had the technology, it'd even be better,
Right.
I'm going to totally write that down.
That is a good idea.
Yeah.
Now, I could get real technical on you guys if you wanted to, and we could talk about an abutment and crown, maybe split design versus screw retained if you'd like.
Sure.
Sure. I mean, I think
always
that
better.
Grammy, you want to go with that?
Sure. Well, I think the industry is kind of moving everybody towards more screw-retained restorations, which is great. Obviously, no cement sepsis, one piece, easier to do. But the great thing about the CEREC software is that it's not right for every situation. So sometimes we have to split it, do traditional cement retained, and you can basically decide based on the clinical situation. You can do both. Now we've got multiple different materials to use. You can use zirconia, you can use Emax, and most importantly, you can get it all done in one appointment.
Yeah, I particularly like with the Emax the way you can build the emergence profile using with the tie base. Start right from the fixture level, come right on up with the emergence profile you want. With any type of gingival recession that may happen, in the future, the shading of the tooth is the same. You don't run into that metal stock abutment.
Correct.
Yeah, and I'm a big fan, of course, with TelioCAD, using TelioCAD with immediate implants, just not having to worry about putting any sort of temporary material within the tooth socket after I've just placed my implant. So there's so many exciting materials. Now, Inamic is out. Have you guys done any stuff with Inamic, or
I have.
played
Not
with
yet.
it?
I
As
have.
far as from an implant situation.
Implants now.
And how do you feel about the flexion with the tie base?
I mean, the real answer is I don't know. I don't think anybody knows yet. It hasn't been out long enough to know. But I think the biggest advantage of Inamic as an implant material is the speed in which you can mill it. Mm-hmm. So that's going to open up the doors to potentially other applications, maybe an immediate custom healer or something like that. Just because it mills so fast, you can't put it in the oven. You can get done a lot quicker. So when you're doing your surgical appointment, you can have a customized healer in just maybe 10, 15 minutes.
Yeah, the digital workflow that we have now, being able to create custom temporaries or custom healing abutments with the TelioCAD. I know all of us here have done anterior cases where we can create a custom temporary. It's out of occlusion. The patient gets to heal. The tissue gets trained from the day of surgery. And then when the patient comes back in, we just have to take the same file. We don't have to rescan the patient most of the time.
Right.
Just swap out the parts, basically.
And I like custom healers, but I only like it when I really got to preserve that papilla and that architecture. But, anymore with the software, how you can develop the emergence profile, I just put a screw or a healing head on it and make an incision and let it heal.
Sure. If you guys had to have a wish list of an implant material, what do you guys think you would have?
The actual implant itself or the temporary?
Well, I mean, one problem I had, and I love TelioCAD, but it's an acrylic-based material. I would love to have a composite-based material. And I know Inamic is a hybrid, but being able to bond back and develop my emergence profile without having to use something like SR Connect to connect composite to TelioCAD. Yep. I would love to have a material that was just a straight composite block that I could make a temporary with that material.
Yeah, just roughing it up, apply some bonding adhesive, and add your contours as you want. Now, that'd be really nice to do. You can do it with Inamic, but you're going to have to take it off, use something like hydrofluoric acid or etch and prime, and to add any kind of a contact. It'd be a lot easier if you could just apply some bonding agent and recontour.
Sure. You guys, it seems like everyone seems to own the new zirconia furnace but me. But are we able to use the meso block in that furnace?
Yes, you can.
Yes.
Okay.
So you can mill it. The difference is, as it stands currently, you cannot mill it. You have to grind it with a 20 burrs, but it can be done, and it can go in the furnace. I think it's about a 30 to 40-minute fire.
Because you're grinding it's a wet mill versus a dry mill, so you're gonna you have to dry the drying cycle.
It is definitely possible.
That's exciting to me.
Yeah.
'Cause even though I love Emacs, one thing that does worry me a lot is a lot of times where I'm doing abutments, they tend to be fairly thin.
Yeah.
And then I worry about that 600 micron limit.
Especially with the anteriors.
Yeah.
Lower, especially laterals. Every time you get a burnout, almost
Yeah.
exclusively. So having something that's a little bit stiffer and also a little more opaque to block that tie base out is going to be nice to have.
No,
So
absolutely.
let's talk
Then
my
again,
favorite
if you have any
topic, though.
failures with it.
What's your
What's
favorite
that?
topic?
Money.
Money.
That's my favorite topic, too.
Well, women, but let's talk money.
Women and money.
Actually, they go together a lot of times, but we won't talk
But
about
anyway.
that.
Usually the first loses the second.
That's right.
Yeah.
But when we look at what we can do with CEREC and Galileos and everything, from the price point of a surgical guide to a tie base to the block cost, you know, when we can do something that's under $250 from surgical guide to final restoration, and you can't grasp that savings in your practice, it's like, what's going on?
I can't get a custom abutment for $200,
I know.
let alone the whole,
I think
every
if-
single piece.
I think if you even take it a little bit further than that, what it allows you to do if you're doing everything yourself, you can actually control the total overhead.
The whole thing.
You can come up with
absolutely.
you can come up with a price to give to patients, because in traditional treatment planning with implants with specialists, it's very difficult to treatment plan it when you have no idea what the specialist is going to charge. So now when you know exactly what your fixed costs are, you know exactly how much money you want to make, then you can set a fee and just give the fee. And what I've found is my treatment planning skills with implants have shot through the roof, because it's much easier for them to make a decision when they know the expectation of how much it's going to cost before they start.
As I say, treatment acceptance is a lot more. You can just say, this is what it is to do the implant start to finish. You don't have to tell them, well, this is how much it is for the implant, then you got to get the custom abutment from here, and the specialist is going to charge this, and I'm going to charge that. It's just, here's the flat fee, this is what it costs, they want to do it or not.
I think actually if we were to back on the wish list, how do you guys feel about some company developing a temporary tie base?
I'm all for it.
I would love that.
I'd love to have
would
that.
do that. That's
Yeah.
one thing that I don't. I mean, I have no problem burning out the tie base from the Telio. It's pretty easy. Just run it through the Impress cycle.
Right.
But to be able to, sometimes you have to take it out, do whatever. So yeah, I would love to have a temporary tie base.
Let's work on that for next year.
Okay.
Okay.
I'll go get my engineering degree and see how that works.
Closing comments before we wrap it up and roll out of here.
Sirona's been outstanding in implants, from design to placement all the way to the final restoration. I mean, I can't imagine. When I started doing implants was in 1982.
Wow.
I couldn't even imagine what we're doing today. I mean, it's just been incredible.
I couldn't either because I was in 8th grade, but
Let's not go there.
And August probably wasn't even born yet.
Oh God. No, it's exciting times. Are really in the infancy of implantology with Sirona. So I'm really excited to see what happens.
And with the
I think
merger with Dentsply, it's even going to get bigger.
right.
Oh yeah.
Yeah.
I think what Sirona's really been successful with is getting people who never really imagined that they would do this type of dentistry into this type of dentistry. You know, even up until 5-6 years ago, I never really thought that I would be doing implants. Restoring implants, yes, but now with all the integration, it kind of opened my eyes to push me forward into actually doing the surgeries.
Well, and also the specialists are starting to get on board. When I was having lunch with an oral surgeon out in New York, he's buying his second practice that he's adding in another cone beam and AC unit because he wants it there because his productivity increased $1 million last year because of what he's doing with the integration of CEREC and the cone beam in his office with all of the general dentists that refer to him.
That's the thing. I
They're
mean,
so cute when they buy CEREC too, because you have to like teach them stuff like how to use a mouse.
He was actually in the Accept class with me.
Yeah.
And I used him as an example. Like, it's so easy, even an oral surgeon can do it. So
Yeah.
there's no reason a general dentist shouldn't be able to buy into this technology.
Totally.
I mean, for the oral surgeons, I mean, it is. I mean, I trained an oral surgeon, bought a CEREC AC unit for the sole purpose of being able to restoratively plan his
out.
implants.
Yep. The world's our oyster at this point with implantology and where the technology and the manufacturers and Sirona Dentsply are going with all this.
Am I going to see you guys? We're back to Vegas next year?
Vegas.
Vegas.
Yeah,
Vegas,
I
baby.
think I might
Vegas.
hit that. Yeah.
All right.
All right.
Guys, thank you so much.
All right.
Thank you.
Thanks for
Thank
also
you.
putting up with all the nicknames. We just thought we'd do something different today.
Yeah, I didn't get one. Did I get
Yes,
one?
you
Yeah, smorgasbord.
smorgasbord.
But we'll explain that
We'll
later.
explain that later when we're off camera.
Yeah.
Yeah.
Jesus Christ.
Thank you so much again, guys. We're taking
thank you.
yet another break, and we'll be back with more Zero World 2016 in just a couple of minutes, we think. We hope.
All right.